Indonesia secara resmi mencatat lebih dari 100.000 kematian akibat COVID-19.
The Philippines now among the top 20 countries in the world with the most number of coronavirus infections.
Of COVID-19 have been recorded in Cambodia.
So I really hope that this gathering more than a meeting. Let us discuss, let us debate, let us argue, let it be a milestone where our collective voice will help shape a resilient, equitable, and sustainable future for health in the Asia-Pacific region. So thank you so much. Enjoy Jakarta, and I wish us all a fruitful, inspiring dialogue ahead. Thank you so much.
Ya, seperti kita ketahui pandemi 4 tahun yang lalu itu atau 5 tahun yang lalu cukup menyeramkan ya. Banyak warga Indonesia yang memang banyak kehilangan pekerjaan, banyak yang meninggal, terutama untuk teman-teman komunitas itu banyak yang memang terkendala untuk mengakses layanan kesehatan karena tugas kesehatan itu sangat fokus dengan COVID-19 pada saat itu, sehingga kebutuhan dasar yang memang dibutuhkan oleh teman-teman komunitas, terutama teman-teman yang HIV positif itu sangat di nomor 2 atau di nomor 3 kan, kurang lebih seperti itu.
During the COVID-19 pandemic, health services are largely interrupted because of the lockdowns in our country. So, like for example, the HIV services and TB services, the PLHIV or people living with HIV cannot get their medicines, or the TB patients cannot get their medicines from their treatment hubs. So that's a big problem during the pandemic.
I think my experience in pandemic preparedness, prevention, and response. We are a CSO, so right now we are hosting a platform. It's called Pandemic Preparedness, Prevention, and Response Platform.
Chopper itu sebuah platform, jadi community engagement dalam penanganan kesiapsiagaan, pencegahan dan kesiapsiagaan terhadap pandemi yang memang leading sektornya itu dari teman-teman komunitas. Teman-teman komunitas itu terdiri dari orang yang dengan HIV, teman-teman mantan pasien TB, serta mantan warga binaan. Jadi selama ini Copercaya itu kita mendorong bahwa community led ini cukup penting dan bisa membantu program pemerintah dalam penanggulangan penyakit menular.
The characters of this group or the coalition is, I can say that it's diverse, and because their characters, because of the different sectors that are involved in this coalition, they can bring up different their sectors problems or issues they can bring up to the government through the coalition.
PPR or Pandemic Preparedness, Prevention, and Response Platform. There is like a diverse of member who are from, like I said, community network. Community networks, meaning that the community network of people affected by HIV, by TB, by malaria, and then plus other youth network. It's called Yankee Population Network in Cambodia, and then I can see diverse group who are members of this particular platform. So this is how to say. The voice from other sector or other background to come together to support or to join this particular PPR platform. I think through the Cooper CE project as well as the PPR platform, we have built the capacity of community and CSO on PPPR. That before we never had such this intervention before, but right now we have tools. We have PPR training manual, we have engagement guide, we have community-led surveillance, to support PPR response. So I think this tool have been introduced to PPR platform member. In addition to that, the PPR promotional material has been developed and also disseminated widely, among community members.
The commitment of the governments of Cambodia, Indonesia, and the Philippines will help sustain the initiative of copper. At the same time, the commitment and the active participation of the copper platforms, the copper coalitions, and the copper task forces are already there, and they participate in not only in the meetings but all around the work that the copper does at the country level. So I think it will sustain. It would be helpful to have the funding for it, but the political and the social commitments are there.
I think the most important advocacy for Cambodia for the copper project, it should be the government integrate all the this advocacy activity into the national system, because if we're thinking about the sustainability of the project, it's better to integrate the advocacy activity into the national program, the country, especially the Ministry of Health.
For example, the Office of the Civil Defense, since they are in charge with health emergencies, especially for the country, they committed to support the resilient health system for the communities.
Pastinya dari pemerintah Indonesia dalam hal ini Badan Nasional Penanggulangan Bencana mengucapkan terima kasih dan apresiasi kepada komunitas lembaga dari 8 negara yang berkumpul hari ini untuk membahas bagaimana pandemi dan penyakit yang lain, menular yang lain, sehingga ini tidak menjadi pandemi, dan pastinya komitmen pemerintah Indonesia bagaimana penanganan dari sisi kesehatan itu menjadi penting. Namun saya juga mengingatkan kembali bahwa dengan adanya risiko bencana di Indonesia cukup besar, dan Indonesia adalah daerah rawan bencana, sehingga memang perlu kita merencanakan dikala ada pandemi, ada penyakit itu, kalau pada saat itu wilayah yang terjadi bencana.
My hope is that through the copper project, however short it has been, we've established networks, platforms, task forces, and coalitions on copper that even if the funding will end, they are there already, capacitated and very passionate to work together for community engagement in pandemic response. Of course, without resources and without support, even if the platforms already exist, they would struggle to be effective. So I hope that the governments and the civil society work together in countries to institutionalize the modality where any response in the country that relates to health and pandemics incorporate community perspectives and become part of decision making.
So even though the project is ending in terms of the funding that it's getting from the Global Fund, I would believe that the government agencies that were involved would also be supportive in making sure that communities will continue to be engaged when they develop their plans and their activities to implement preparedness and response in relation to pandemics and health emergencies.
There's always a hope, and I believe that these challenging situations, at some point, we can conquer them and we can face it together.